Today is World Diabetes Day. 3 in 5 people with diabetes in South Africa are undiagnosed. So how can people prevent or live with the disease? Monteng Botloko is a type 2 diabetic. She joins us now along with endocrinologist Dr. Sandeep Ruda. Ruda, thank you very much for joining us. What does that mean, type 2?
It means that, doctor, if I'm correct, it means that I'm not taking the same medication as a type 1. I'm on oral medication, whereas a type 1 is on insulin. But later on, the doctor realized that my blood sugar is not controlled with only oral, so they can move me to insulin. So that means my diabetes is on water, they would say, on my urine and whatnot, yes, not on my blood.
So you were diagnosed, but it's shocking to hear how many people remain undiagnosed. Why is that?
So, Jane, there are a couple of things. First of all, just to add to the first question first. Type 2 diabetes is the primary major form of diabetes we see in the world. And it's the epidemic that is driven by many risk factors like an unhealthy diet, sedentary lifestyle, stress, smoking, all contribute to this risk. It's different from type 1 diabetes in that the patients are generally diagnosed later. A type 1 diabetic patient is diagnosed early in their disease. These are patients, type 1 diabetics, who have failure of their beta cells for various reasons early, and they need insulin from the get-go as their treatment.
What's a beta cell?
So the beta cells are the cells in the pancreas that make insulin that lower blood sugar. When we eat, your blood sugar tends to rise. You need to move that out, and insulin is the hormone that does that. So they have an acute problem. Type 2 diabetes is more insidious in onset. So there's some pancreatic beta cell dysfunction. You're not able to make enough insulin over time, and there's a resistance to its action. So that's why patients like that will initially start off on absolutely important lifestyle modification, some tablets. The number of tablets may escalate, and eventually they may need insulin as well. And the reason many people remain undiagnosed is the symptoms are often non-specific. Fatigue, weight changes. They may have, when the blood sugar levels go very high, excessive thirst and excessive urination. They may get infections recurrently or poor wound healing. So, you know, these kind of symptoms are not very specific and they're very insidious in onset. So,
how did you know there was something wrong with you?
It was a normal day. I was at the office and I felt very tired. So my daddy was diabetic, so I knew the signs of diabetes. I went to the doctor and the nurse immediately said to me, "I'm calling an ambulance for you." My sugar reading at that time was 23.5, and she said you could collapse any minute. And that's how I found out I was diabetic. I was sent to the hospital, and since 2011 I've been living with it.
And how do you feel now, taking the medication? Is your life better?
Way better than it was before.
Are you eating better?
Yes,
doing
I'm
more
eating
exercise?
better. Yes.
So what should people look out for? I mean, other than that sort of fatigue, what are the telltale signs, and how do you prevent this from happening?
So I think the first thing is to be aware of the risk factors and if you're at risk. So any person over the age of 45 should get themselves screened at a primary healthcare clinic, your GP, any healthcare facility. And the diagnosis of diabetes is easy to make on a blood glucose level. Persons who are not age 45 and above but have risk factors. So if you've got a family history of diabetes, if you're overweight or obese, if you've got hypertension or cholesterol issues, if you're a smoker, if you've had issues with glucose control during pregnancy, these are all risk factors. So these are patients at high risk. So they should get themselves screened as well. Hey?
Can it kill you?
Diabetes. Absolutely. The reason why we do all of this work and awareness is that diabetes is a condition, if not controlled well. In the long term, the complications are heart attack, strokes, kidney disease, eye disease, amputations, you know. So very drastic consequences which we want to prevent. And in our country and around the world, in developing countries, these are burdens we cannot afford on the healthcare system, and individuals suffer. World Diabetes Day is today, and the emphasis is on diabetes and the family, the impact the disease has on the individual, on the family, and how family can come together to support care and even help prevent diabetes. More than 50% of type 2 diabetic cases are preventable through healthier lifestyles, etc. So I think the emphasis is on that this year. Yeah.
And the message, if you're not feeling good, if you're feeling tired, lots of other symptoms, go and get yourself checked out.
Yeah.
Thank you
Yes.
both for coming in. Thank you.
Thank you.